Joining us today on our Tuesday Impact Health Educational Webinar. My name is Lauren McQueen. I guess I didn't introduce myself. I live right outside of Austin, Texas in the beautiful Hill Country. But for those of you that this is your first time, we actually do these Impact Health webinars every single Tuesday. At this time, we were just talking about how we have done this every Tuesday for over a year, and it's been so cool to see this grow from 20 people to 50 people to 100 people. Believe it or not, but 2 weeks ago, we had 500 people tune in to our Impact webinar. And so we have all different types of people on here, business owners, people in the medical fields, normal individuals looking for affordable health care, self-employed people like myself. And so I'm excited to partner with my co-host, who you'll hear from in a little while, Mr. Jeff Street, to share with you what we have our hands on with Impact Health Sharing. And so just to give you an overview of how this meeting is going to go, it's going to take about 45 minutes or so to go through the information. Trust me when I say it's valuable information. I know all of you will leave here having learned something today. But at the end of it, we're going to open it up for some Q&A. And so if you have a question over the course of the presentation, feel free to type your questions in the chat to myself, Lauren McQueen, or you'll see another co-host on here, Melissa Street. Text your questions or type your questions to us, because at the end, we will verbally announce those questions to everyone so that we can all learn together, okay? So diving into what we're excited about. So for those of you that have never heard of health sharing before, health sharing is a nonprofit alternative to health insurance, and it is really benefiting people in America because it's allowing us to save tremendous amount of money on monthly premiums, on actual medical expenses. And so reason why I'm so passionate about Impact Health is my husband's a business owner. He owns a roofing company, and I've been self-employed my entire life, literally since I was 19 years old. And being self-employed, being a business owner, nobody's covering our health care, right? And so as healthy individuals, we always chose to opt out of health insurance because it just didn't make sense for the two of us to pay $800, $900 a month with traditional insurance. So we were introduced to health sharing almost 2 years ago, Impact Health Sharing, and we were blown away. To be honest, I was a little skeptical because it seemed too good to be true, but we got ourselves a quote for just over $300 for the two of us, and we were so excited to get amazing coverage at such an affordable cost. And so it's been a huge blessing for us. We are on a crusade to really disrupt this broken health insurance industry. I'm sure if you're on here, you know that the health insurance system in America does need some help, and we believe that we found an answer to that. And so I'm going to go ahead and share my screen and dive into the presentation. So the first thing I want to do is I want to invite you to our Facebook page. So we have a Impact Health Facebook page. It's called Health Share Crusade Community. At the time of this presentation, we have over 3,100 people in this group. We just started it less than a year ago. You can scan the QR code and it will allow you to join the group, or just type in Health Share Crusade Community. You do not have to be an Impact Health member to be in this group, but this is where we'll post many of the recordings of our Tuesday webinar, so you can rewatch it, send it to people, all that stuff. And there's also amazing testimonials of Impact members who have saved a lot of money, used their Impact card, all of that in the group with some more information as well. So let's dive in. You heard me start the call saying we had our hands on a solution to the broken healthcare system. And so the reality is, when we're talking about where healthcare is in the state of healthcare in America today, the average individual in America paid $780 per month, and the average family paid $2,000 per month for marketplace health insurance in 2022. In 2019, so that's 5 years ago, so you know this number is higher now, but in 2019, 59% of bankruptcies cited medical expenses as a major factor. So the reality is 80% of our country is trying to lower their healthcare costs. 5% of the population, though, so listen to this, 5% of the population is responsible for 50% or more of the annual healthcare spending costs. And what this means is people are overpaying for healthcare every month. And over 100 million Americans are in some form of healthcare debt. And so what do people want? What are they looking for? Affordable monthly premiums. That's what my husband and I were looking for. We did not want to pay $700+ a month for 2 people. We wanted affordable monthly premiums and affordable copays. When we go to the ER, we didn't want to have to pay $600 just to be seen at the ER. We wanted affordable deductibles. I'm sure you do as well. We wanted medical freedom. What do I mean by that? We wanted the ability to go see any doctor, any facility, any physician we want to, and not be confined within a specific network. And then, of course, my husband, for example, and many of you business owners on here wanted to be able to offer healthcare to their employees without breaking the bank. So actually, up until learning about Impact Health 2 years ago, my husband never offered healthcare to his employees, and now they have amazing coverage with Impact Health. So let's dive into health sharing in general. So for those of you not familiar with health sharing, it is not traditional insurance. Matter of fact, it is a nonprofit alternative to traditional insurance. And so health sharing is not a new concept at all. It's actually been around for over 40 years. But Impact Health Sharing has actually only been around for 5 years. And get this, within the next 4 years, at the pace that we're at with Impact Health, we will outgrow the largest health sharing company in the United States named MediShare that's been around for over 40 years. So there are so many people joining Impact from traditional insurance companies, joining Impact from other health share companies. And so health sharing, some of you have probably heard of different health share companies like Samaritan Health, Christian Health Ministries, MediShare, like I said, Zion. But Impact Health is the most modern and contemporary version of health sharing. A lot of other health sharing companies, you do have to prove to be a certain religion or have an affiliation with a church to be part of that health share company. With Impact, we have a come one, come all mentality where anyone, no matter what religion you are, you're able to become an Impact member. A lot of health share members, the way it works with other companies is that you basically pay up front using a cash pay discount, submit it into your health share, they'll reimburse you or they'll apply it to your deductible. But with Impact, it feels like traditional insurance. So you get to take advantage of all the benefits of health sharing, but you don't have to pay up front. You give them your Impact card and they're gonna bill Impact Health directly for you. Way less stress and pressure off of you. And one of my favorite benefits of Impact Health is how they negotiate the price of your medical bills on your behalf. On average, Impact Health is negotiating medical bills down by 72%. I actually experienced this. I was in the ER 2 months ago. I had one of my bills came back $11,600 that Impact repriced to $1,700. Trust me, I'm grateful that I have Impact Health and not paying out of pocket, right? So they negotiate your bills on your behalf, but also Impact is helping individuals, families, and small businesses save anywhere from 30 to 50% per month, as opposed to traditional insurance. So Impact Health is comprehensive medical care, preventative, catastrophic, mental health, chiropractic, you name it. It's comprehensive. And like I said, we have medical freedom. We have the ability to take our Impact card, go to any doctor, any physician we want to, because we have nationwide access to all networks. What I love about that is when I was in excruciating pain at 1:30 in the morning, suffering from pancreatitis, I didn't have to see if the closest hospital to me was in my network. I knew I could just go to the closest hospital to get help. We have Impact members that have unfortunately been diagnosed with cancer. Well, because of our nationwide access to all networks, they're in the MD Andersons. They're in the best cancer facilities in the United States, knowing that they are within network. Well, there really is no network, so they have access there. Free concierge scheduling service. This is really awesome, and this is coming out very, very soon, where if you want to schedule your annual physical, which by the way is free for every member of the family, all you do is call Impact Health. They're going to call your provider educate them on who Impact is, schedule your appointment, and even prepay your appointment for you. All you have to do is show up. It's pretty awesome. Unlimited telemedicine. So I don't know about you, but last place I like to go is the doctor's office, right? And so with this, you're able to have a conversation with a doctor, an appointment with a doctor at the comfort of your own home, wherever you are in the country, whether that's a video call or a phone call. It is 24/7 access, unlimited for every member of the family, and it's free. We use MD Live, for those of you familiar with MD Live. We have phenomenal wholesale prescription pricing. Matter of fact, many of you have probably heard of GoodRx Gold. They're known for having very low prescription pricing. Well, Impact Health 90% of the time comes in lower than GoodRx Gold. And our monthly plans as Impact members start as low as $73 for individuals and just $378 for families of 3+ each month. Free dental and vision discount cards. My husband and I are super excited about that. And we have household deductibles. So with health sharing, we don't actually call it a deductible. We call it a primary responsibility amount. Same exact thing as what you know as a deductible. But many of you have individual per person deductibles. That's a lot of money out of pocket before the insurance company starts to cover anything. Well, with Impact, there's no such thing as an individual deductible. It is just household deductibles, and it's as low as $2,500 for the whole year for the family. It doesn't matter if you have 12 people in your family, you can still have a household $2,500 PRA or a deductible. Health and wholeness credit. So because Impact is a nonprofit, there is no benefit to them for people to get sick, right? And so they actually reward us for keeping ourselves healthy, for showing that we're taking care of our health every month. And so if you show proof of payment to have a gym membership, vitamins, supplement purchases, maybe you're like me and you go to a naturopathic doctor, or you like holistic wellness, IV drips, any of that stuff, every month, if you show Impact just a receipt of one or all of those things, they're going to match what you spent on all those services up to $100, so a maximum $100 a month, and apply that towards your deductible. So instead of having a $2,500 primary responsibility amount for the year, for example, you could drop that down to $1,300 by submitting at least $100 a month of your health and wholeness credits. And then lastly, Impact is available for those who have an ITIN number. Also, if someone is establishing their citizenship or they don't have a social, as long as they have an ITIN and a legal form of ID from Mexico, Guatemala, Canada, or the US, they can become Impact members as well. So who is our target customer? Our target customer are individuals and families who are overall fairly healthy, who are currently paying some or all of their healthcare costs. So 91 million people in the US actually fall into these three categories. Number one, non-group companies with 49 employees or less. Those that are self-employed, like myself, independent contractors, gig or part-time workers, and then obviously those that are underinsured and those with no insurance at all. So I want to kind of dive into pre-existing conditions and hang out on this page for a little bit, because this is a very, very common question that I get. It's, Lauren, if I have this pre-existing condition, will it disqualify me? No, it will not disqualify you from becoming an Impact member. If I have this pre-existing condition, will my monthly payment go up? No, it will not cause your monthly payment to go up. No condition will disqualify you from becoming an Impact member. So I want to explain what Impact's definition of a pre-existing condition is. It's conditions in which signs, symptoms, testing, diagnosis, treatment, or use of medication has occurred within 36 months or 3 years prior to enrolling as an Impact member. So if I had major back surgery 4 years ago and enrolled with Impact today, and I've had no issues with my back for the last 4 years, then that's not considered pre-existing anymore. Okay, if I enrolled with Impact today and I had that major back surgery a year ago, any bills associated with that back surgery would be considered pre-existing until I've been signed, symptoms, treatment free for 36 months. So with medical bills associated with your pre-existing condition, this is really awesome. They still get repriced. So Impact will still negotiate your medical bills associated with those pre-existing conditions down by an average of 72%. The only difference is those medical bills associated with your pre-existing condition will not count towards reaching your primary responsibility amount or your household deductible, okay? So once you've been signed symptoms treatment free for 36 months, then that's no longer considered pre-existing, and that will count towards reaching your PRA. So we're very transparent with people, and we say, if you have, maybe you're with traditional insurance right now and you take very expensive medication and they cover that medication for you, or your condition makes you have to go get, monthly checkups that are not cheap, and maybe your current insurance is currently covering that for you. Impact might not be the best fit, but for the majority of people, it is a phenomenal option. When it comes to high blood pressure or high cholesterol, those are not considered pre-existing for purposes of determining eligibility if you have a stroke or a heart attack down the road, okay? And I will say, if you're 65 years old or older, take everything I just said and toss it out the window, because pre-existing conditions do not count for people with using our senior plan, which you'll hear about if you're 65 years or older. Okay, so let me give you a real life example. This is one of my husband's employees. He lives outside of Denver, Colorado. Was in the hospital back in September. He had a medical bill of $5,751. Impact received that bill. They looked at the price of that bill. They said, this is not the standard rate for this procedure and this treatment, meaning there's profit margin in here. They were able to negotiate that price down. They removed $5,130 from his bill. All he was responsible for was $620. Now, this was a pre-existing condition, okay? He had been to the hospital for this exact same multiple times in the past year. So he paid his $620, got to take advantage of the negotiated amount. The only difference is that $620 just didn't count towards his family deductible or his family primary responsibility amount because it was pre-existing condition. Had it not been pre-existing, that $620 would go towards reaching his household PRA. Okay? So I am excited to hand the call over to my co-host, someone I have so much respect for. He's literally helped thousands of people when it comes to getting affordable health care, and his story with how much money he's personally saved, him and his wife, is really inspiring. And I know that he is just as passionate, if not more passionate about Impact Health than I am. He's on a crusade with me to disrupt a broken healthcare industry. And so with that said, I'm going to get myself out of the way, turn the call over to Mr. Jeff Street. Jeff, take it away.
Well, Lauren, thank you so much. And thank you just for your commitment to be part of this crusade, and just love your passion for Impact Health Sharing. Look, guys, Lauren was one of 40 million Americans that were opting out of healthcare coverage because the cost was so high. And she decided that it wasn't worth paying that price because she saw herself as a healthy person. And, once she was introduced to Impact, found something that was affordable for her and her husband. And, they became Impact members about 2 years ago. And Lauren, as she mentioned, has actually had to use her healthcare for their first time in years, multiple times over the last 2 years. And, when her and I talked, she said, imagine if I still didn't have healthcare coverage, how much money I would have spent over the last couple of years. So just love your personal testimonial. As Lauren mentioned, my family saved thousands of dollars a year with Impact Health Sharing. And, this is something that we're really passionate about, not just for what it's done for us, but the stories that we've heard from so many people. And we're going to hear some of those stories today. But let me first start off by talking to you guys about how to get a quote. It's really simple to be able to get a quote when it comes to Impact Health Sharing. Whoever invited you on the call today, they're a referral partner with Impact Health Sharing, and they have their own website, their own online referral partner link that looks just like this. This one here happens to belong to the San Diego Association of Realtors. This is their link. Some of you were invited on the call today by them, but whoever invited you on the call has a link that looks just like this. And to get a quote, all you need to do is to put in the date of birth of the oldest person in the family, and then put how many people are in the family. So let's say we're looking at March 30th, 1989, and it's a family of 3+. We click on Get Quote, and it's going to go out and it's going to generate a quote, for that family of 3+. So you can see the quote right here. anywhere from $404 a month to $576 a month for that family of 3+, depending on which primary responsibility amount that they choose. So let's break this down a little bit. One thing I love about Impact is, there's not like a platinum plan and a gold plan and a silver plan where there's something completely different on every plan. For me, this was just very simple and easy to understand. The only thing different about the 4 options that each quote is going to generate for somebody under 65 is the primary responsibility amount that somebody chooses and the standard rate that they choose. Now, when it comes to primary responsibility amount, like Lauren mentioned, those words are synonymous with combined family deductible. So there's 4 options on every quote: a $2,500, a $5,000, a $7,500, and a $10,000 PRA. Again, remember, think of that as a combined family deductible. So the lower the PRA that you choose, the higher your standard rate is going to be each month. Standard rate, that's the same thing as like a premium, a monthly premium with an insurance plan. So the lower your PRA, the higher your standard rate. The higher your PRA, the lower your monthly standard rate is going to be. So you can see for this family, if they chose the $10,000 PRA, that's $404 a month. If they chose the $2,500, that's $576 a month. So let's break this down a little bit more. Let me explain how this works to you. So let's say somebody was on the $2,500 PRA. Now, they're responsible for that first $2,500. Just like if you have an insurance plan, you're first responsible for your deductible. So somebody's responsible for that first $2,500 PRA. Once they've met that $2,500 in eligible medical bills that they've spent money on, now they're eligible for sharing. Now, in the insurance world, sometimes there's an 80-20 split. Sometimes there's a 70-30 split. With Impact, it's like a 90-10 split. We call it co-sharing. So once you meet your PRA, the Impact community shares in 90% of your eligible medical bills. You're responsible for 10%. Again, that's called your co-share. Now, the most that a family could ever spend per year in co-share is $5,000 a year for the whole family. So think of that like a max out-of-pocket expense. Once you've met that $5,000, now the Impact community will share in a 100% of your eligible medical bills. Now, let's give one more example of a quote. Let's just take the same date of birth and we'll make it just one single individual. We click on Get Quote. And there's the quote for that individual, anywhere from $102 a month to $246, depending on which PRA that you choose. Now, if you get yourself a quote, and let's say you've got questions because you have diabetes, or you have questions because you have high blood pressure, or you have questions because you had knee surgery a couple years ago, you've got personal questions about your health, or you have questions in general, you can just submit yourself in as a lead. You can just put in your name, email, and phone number right on your referral partner's website, click on Learn More, and you'll get a text message and an email from somebody with Impact Health Sharing with a calendar invite to schedule a consultation call for you. They'll talk to you, answer your questions, and if you like what you hear, they'll direct you back to your referral partner's website so you can go ahead and enroll as an Impact member. Now, the enrollment process takes only about 15 minutes. There's no urine test required or a sample. There's no blood test required. It's all based on the honor system. And it only takes about 15 minutes for a family to enroll. And then your Impact membership begins the first day of the next month. So if you would like to be an Impact member by November 1st, you simply just need to make sure you're enrolled by October 31st at 5 p.m. Eastern Standard Time. And your Impact membership will start on November 1st. Now, let's talk about seniors. I know Lauren had mentioned seniors earlier on. Right now, seniors are going through their open enrollment. Open enrollment starts for the rest of us on November 1st, but for everybody else, and with Impact, just a great thing to know, there's no such thing as open enrollment with Impact, meaning somebody can become an Impact member any time of the year. And again, their membership begins the first day of the next month. But many seniors are going through what's called open enrollment right now, where they're shopping for their supplemental plan. So here's the requirement. If somebody's a senior and they're looking at Impact, they have to have Medicare Part A and Medicare Part B in order to qualify for Impact for Seniors. Now, Impact for Seniors can replace the supplemental plan that they have currently. As Lauren mentioned, there's no pre-existing condition criteria for seniors. Seniors have a $1,000 PRA. You're responsible for that first $1,000, and then Impact will share in everything that Medicare Part A and Part B does not cover for you. Now, for seniors, if you also have Medicare Part D, Impact will also share in your prescription cost as well. And the price for a senior is going to range from $96 a month to $140, depending on what your age is. So we've seen some seniors save $100 and even $200 a month off of their supplemental programs in some cases. Now, let's talk about small businesses. This is the big deal right now. Look, healthcare costs are rising. They're anticipating another 7 to 25% premium increase as people are getting their renewal notices right now as open enrollment's about to beginning. Just like homeowners insurance and auto insurance has risen, health insurance costs are rising as well. And unfortunately, with all the other inflation that's hitting our country, there's several small business owners right now left to make a decision. Can I continue to afford to offer health care for my employees? You know, and it's just even unfortunate that some are in that situation of making that decision. We can step in and offer a big value for those businesses. See, our target market when it comes to businesses is employees, our businesses with 49 employees and less. Again, there's businesses that are suffering turnover because they can offer healthcare, not attracting the same quality of employee because they're not able to offer healthcare or not able to offer a good healthcare plan. On average, we're helping small businesses save 40 to 50% on their healthcare costs. Now, if you're a small business, right on your referral partner's website, there's a link for businesses. You can submit yourself as a lead. You'll get a census tool where you'll be able to get a quote for all your employees. And then you can schedule a calendar invite with an Impact Group administrator that'll answer your questions and present Impact to your staff, to your employees, answer their questions, and they'll help you get set up for Impact for your business. Now, this is the Impact member card. So many of you have heard of healthcare sharing in the past. As Lauren mentioned, Impact was really the first company to be architected to look and feel like traditional health insurance, but still being healthcare sharing. Many of you have heard of a great company called Medishare. Look, they paved the way for this industry. The former CEO and president of Medishare, the individuals that scaled them from 8,000 to I think it was 150,000 members in a 3-year time frame. That was the fastest growth curve ever in healthcare sharing. They wanted their company to be more contemporary, more modern. And when they got pushed back and they weren't able to see them make those technology changes they were pushing for, they decided to break away from that entity and start their own technology platform, a platform that's industry leading, best in class, most transparent. And they got together with the executive team of Impact to be the first company to launch this technology platform that I'm going to show you here in just a minute. But again, what this did is it made it look and feel like traditional health insurance. So here's your Impact member card. As Lauren mentioned, every member gets a free annual wellness visit or free physical per year, each member of the family. You also get a $150 blood work credit per year per member of the family. Also, Impact, as you can see, has free telemedicine, free MD Live. Love that. That's 24/7. One other great thing about Impact, people that, get chiropractic adjustments, you're going to love this part. Impact gives all their members 50 outpatient therapy visits per year where there's no provider fee, which is like a copay associated with those visits. So I'm talking about respiratory therapy, chiropractic adjustments, physical therapy, occupational therapy, and so on. So there's no provider fee associated with those visits, and you get 50 per year as an Impact member. Also, after you get your annual wellness visit, you want to go back to your primary care physician. That's a $50 provider fee, again, which is like a copay. Let's say you want to go to the dermatologist or a specialist. That's a $75 provider fee, which is like a copay. ER and inpatient, that's $150. When I had my previous health insurance company, it was $600 copay for ER and inpatient. So very affordable provider fees. And I also love, remember, people that are proactive with their health, that are spending at least $100 every month on their health, get the $100 credit, where you can go to naturopathic doctors, holistic wellness, acupuncture, IV drip therapy, vitamin supplements, you name it. You get a $100 credit every month to offset that family deductible, that PRA. Now, on the back of the Impact card, this is what's important for the providers. And I know that we have a lot of medical professionals on the call today. Many of you maybe are already Impact preferred providers. And some of you looking to learn more about that today, you're going to love that part. See, the way Impact was designed, they invested the money in all the clearinghouses in the country to have what's called their EDI payer ID number. What that means is they're coded the same way as commercial insurance. This is not normal with healthcare sharing, meaning normally if somebody has healthcare sharing, when they go to the doctors, they have to pay upfront as a cash pay discount, get their medical bill, submit it, and then wait sometimes several months to be reimbursed, which could be a cumbersome process. With Impact, when you go to the provider, you simply just hand them your Impact card. They put that payer ID number in their billing system and allows them to bill Impact directly, just like they would bill a commercial insurance company. But what's really amazing is we're so provider friendly. We're processing and paying medical bills on average in under 15 days time. And we're paying 130 to 160% of the Medicare rate. So providers on the call, we're paying you a lot faster than typically you get paid by the insurance company. In many cases, also more than you're used to getting paid. We are paying fair market value and we're paying it quickly. So when you go to the doctors, you give your card, they put that payer ID number in, they bill Impact. Now, in some cases, there's going to be, and I just want to be very transparent with everybody, in some cases, there is going to be what's called provider pushback. And here's what that means. That means when they go to the doctors, they say, well, we've never heard of this, or this is health sharing. You got to pay up front. Now, just understand that this is something that's going to happen because you're not used to the way that Impact does it. So if that ever happens to you, like it's happened to me before, it's okay. Just say, look, just put our payer ID number in your billing system. We're coded the same way as commercial insurance, and you can bill Impact directly, just like commercial insurance. Now, if they put that payer ID number in their system, they're going to see that. Many of them are, wow, this is great. You're right. Sometimes, for whatever reason, they just refuse to put their payer ID number in. That's okay too. Just say, listen, just do me a favor, call the member support number on the back of the card, and they're going to explain this to you. Now, sometimes I've had to tell them a couple times to call. When they call, they're like, wow, this is great. You're going to pay us more. You're going to pay us faster. Worst case scenario, if for some reason they still will not do that. Now, in most cases, they will do that. But in the case that they don't, as a worst case scenario, as an Impact member, we can just always pay up front as a cash pay discount, submit that medical bill to Impact, and Impact will reimburse us as the member as quick as they're paying their provider, as long as we've already met our PRA. If we haven't met the PRA yet, it'll just be applied to the PRA, the full amount that you paid. If you have already met your PRA, they pay you back the member as quickly as they pay the provider. And for providers, I'm sure that this is music to your ears, what you're hearing. And to become credentialed as a provider, it typically takes less than 10 days. And I know for any doctor's offices that are on the call, you're probably used to it being 6, 7, 8, sometimes 9 months to get credentialed by an insurance company. On average, you become an Impact preferred provider in under 10 days. And then our goal is to send more customers to you. Now, here's actually a couple examples. Lauren talked about reference-based repricing. This was actually an employee for Lauren's husband's company. This was somebody that previously had no healthcare coverage. They opted out because the cost was so high. When Impact was introduced to them as an option for them as an employer, she opted in. She got a plan with a $5,000 PRA for $153 a month. A few months later, she got into a big accident and got a $200,000 medical bill. Now that bill got sent to Impact electronically. Impact looked and they were getting charged an outrageous amount. And Impact advocated for her as a member. They repriced that medical bill down to $20,172. A savings of just under $180,000. She had her $5,000 PRA, so she was responsible for that $5,000 plus her 10% co-share. So you can see she paid $6,500. The community shared in $13,655 of her medical bill. Here's a personal friend of mine that became an Impact customer. His wife went through a lot of procedures. She's cancer-free now, thank goodness, but there was a scare. And here was, they're out of Connecticut, so here's a medical bill. $37,659. Impact negotiated that bill to $14,000. They had already met their PRA. Their responsibility was just the 10% co-share, $1,400, and the community shared in $12,613 of her medical bill. And you can see the message there from Rick. Once was a skeptic, today somebody just truly passionate now about the crusade that we're on with Impact. Let me show you guys one last piece. And then I have a couple people I want to have you hear from. We talked about Impact's member center. So this is actually my member center right here. So if somebody logs in, I love the philanthropic piece. The first thing they see is prayer request. And look, I love knowing where my money went to. When I had health insurance, I would pay them every month. I never knew where the money went to. Look, you can see when I log in, first thing I see, Jeffrey, you and 373 other Impact members have been matched to help the Isaac household pay a medical bill of $62,480. An amount of $157 will be debited from your share account. And so I love, look, $157 that I was going to pay anyway, it went towards that family. Now I can send them a prayer request, I can send them a get well, or I can remain anonymous. But I love just knowing what my money's actually going to. Look, you can see prayer requests for different people. I can actually go and see my own personal Impact account. Each of us has what's called decentralized reserves. So we all have our own Impact member account. Here's my account that's pulling up. You can see what's in your account currently, what families you've helped. And look, you don't do anything. It's all through technology and an algorithm. So right now, $1,700 is just sitting there in my account. Here's the families that I've helped over the last 8-9 months. I can see what money has gone towards the share, what goes towards program fees, admin fees. They just lay it all out there, and it's fully transparent where we can see where every dollar goes. You can even see the entire community. You can see what do they have in financial reserves. You can see how fast are they paying their medical bills. You can see how much did they spend in medical bills last month, $900,000. You can see processing and paying medical bills, 15 days. You can see the largest share needs last month, the U household, the Calendar household, the Taylor household. You can see all of it. But I love this transparency. The goal of a healthcare sharing company is to have 3 to 4 months of financial reserves. Impact currently has over 10 months of financial reserves. We are setting a new industry standard. And because we're a nonprofit and we have so much in reserves, it's allowing Impact to offer additional things to their members, like a free dental and vision discount card. And you can just take this IHS for Impact Health Sharing, IHSismile.com, and you can learn all about our free dental and vision discount card. You can see some of the savings here, a routine checkup, on average savings of 63%, oral exam, x-rays, and you can see the percentage. And, this has been phenomenal for so many people. And this is included in the Impact membership for free. I'll show you 2 last things. I can see what's going on with my account. How close am I to my PRA? Look, right now, other than my free annual wellness visit for my wife and I, we've had no medical bills this year. Our Impact membership starts on July 1st every year. So we have had no medical bills, but we've already used $400 of our $2,500 of our PRA. How is that possible? Well, it's that $100 monthly health and wholeness credit that we receive. That's $300 of the dollars. And then another $99 from 2 chiropractic adjustments that we got. So look, even though we've had no medical bills, we literally have already used $400 of our PRA just because that health and wholeness credit. The last part is our prescription pricing, as Lauren mentioned. We are cheaper than GoodRx Gold, literally over 90% of the time. What's great, they compete all the local pharmacies against each other. Somebody had me search this yesterday. It's lisinopril, I think it's called. This is a common high blood pressure medication. I search it. It's going to show me all the local pharmacies. I'm going to know the price before I go, so I can make sure my prescription is sent to the pharmacy that's going to charge me the least expensive price. This is a very inexpensive drug with our program. Look, $1.51 at Tom Thumb, $1.76. Kroger Pharmacy. I can show more. I can look at all the different pharmacies right here where I live, and it'll show me the cheapest price, so I can get my prescription sent to wherever the cheapest price is. Now, we've got 2 members here today that I'd love to be able to just have them share their member testimonial, and then we'll spend the remainder
Recording
of the time
in progress.
today. Then we'll spend the remainder of the time today just answering any of the questions in the chat that are relevant for everybody that haven't been answered yet. Now, if it's a question on your own personal medical situation, make sure you send that into Impact, so that way you can talk to somebody about your own personal situation. But the first member is Heidi McFarland. Heidi, thank you for being on our call today. I heard your story earlier on, and I just really appreciate you being on. You guys are going to be blown away with the savings that Heidi's family's received, and also how Impact's been working for her. So Heidi, thanks for being on. I'd love to have you share.
Well, thank you so much, Jeff. Much appreciated. And Impact has truly been a blessing to our family. We have saved $24,000 by switching to Impact, which is tremendous. And also we have utilized the health and wholeness credit to lower that primary responsibility amount, which is fantastic. We have not come across that with any other insurance before. And also we went to the pediatrician. They were like, what is this? Health share? I don't know about this. But once I explained how it works, they put it through their billing system and they got paid. So it's just amazing. The pediatrician is very happy. So yes, we are so blessed and so excited to share Impact with family, friends, and church members. Well, thank you so much, Jeff. Back to you.
Well, Heidi, let me just have you stay here with me for a minute. So first off, $24,000 a year in savings. $2,000 a month. Look, that might be a mortgage payment for some people. What does that mean to your family, at extra $2,000 a month back in your pocket?
Oh, it's tremendous. I mean, the economics that we live in right now, everybody's affected by it. So for us, definitely a blessing. Yes.
And look, I know we have some financial folks that are on the call, people that do life insurance, folks that are financial advisors. I know my new friend Luke is on the call. We got connected yesterday. Luke, imagine saving one of your clients $2,000 a month. How you can help them repurpose that when it comes to their investments. And I love your story, Heidi, but I also love how you brought up exactly what I was talking about. Look, that provider pushback, it's real. And we just want to be transparent with people that, look, that's something that can happen. At first they said, no, healthcare sharing, you passed, and you educated them. And what did you say to them? What kind of made them say, okay, yeah, you're right?
Well, basically I told them what it is, how it works, like the insurance, the EDI payer in the back. They put it into their system. They sent the bill to Impact. And then I can see my back office, my member center, that it got processed and paid. So it was just, yay, it works. So it was exciting, set up as insurance, but it's health share. And I love that we're sharing each other's needs.
Well, thank you. I think just an important point, for people to understand. Look, sometimes they just put in the payer ID number, no problem. Sometimes they give that pushback. Hey, look, it's coded just like commercial insurance. Put the payer ID number in your billing system, and then they did it and billed Impact. So, thanks for sharing your story, Heidi, and thank you for being on this crusade with us. We also have Ken Potter on the call, and Ken is from the healthcare space, so he has a unique perspective. And Ken, I'd love to have you share about your experience as an Impact member.
Yeah, you bet. You guys have been in the healthcare world for longer than some of you have been alive. I have 41 years now. I'm a licensed respiratory care practitioner in California. I've worked in hospitals, neonatal intensive care units, trauma 1 facilities, a lot of boots on the ground at the bedside, transitioned to medical device sales and worked with a multi-million-dollar medical device company, a VP of business development. So I've seen a lot of different perspectives in the healthcare world. over the last 40 years, but I recently had a perspective that I'd never had before. And I'll tell you, I had a heart, something happened with my heart, a condition. Everything's good now, you guys, but at that time, ambulance to a hospital. And then that hospital couldn't take care of me the way that they needed me to be taken care of. So they transitioned, had me picked up by another ambulance to transition me to a cardiac facility. And, went there, had everything done that I needed to have done. Got discharged, was going about my life. Everything was good. And you guys, I got a bill from the ambulance company for over $2,000, if I recall, and telling me I was out of network for the ambulance transfer, meaning from one hospital to the other hospital. They picked the ambulance picked me up. I've got IVs in, and I'm trying to, and now they're telling me that ambulance transport was out of network. And you guys, let's think about this. Like when you're flat on your back on a gurney, you don't get to pick what ambulance you want to, like you can't call up, hey, are you in network, right? Like you go with who sent you. And it just got me into thinking, I've been in this world for so long that, how traditional health insurance companies, how do they make money, right? They make money by increasing rates. They make money by denying claims and having this out of network piece. You guys, that's my story, but I know that there's multiple other people on the line that have that exact same story of the in network, out of network. And when we see Impact Health sharing, no network restrictions, just the peace of mind that's given to our family. We went from traditional Blue Cross coverage, about $1,800 a month, down to, with Impact Health sharing, $600 a month. No network restrictions. I've got multiple conversations I could have with you about being able to pick a doctor that we really wanted to go to. You guys, I've got insight on what doctors to go to and what ones not to go to. And being able to pick the doctors to go to for our family has been huge for us. So I love Impact Health sharing. I hope that that gave you guys a little bit different perspective, but honored to be able to share our story today.
Well, appreciate you sharing, Ken, and appreciate your perspective. And one last thing for you too, obviously there's so much value in the fact of not having to worry about what network you're in. I had something similar happen to me years ago. Really, the only time I ever really used my health insurance other than my annual physical was I found out I was out of network once I got the bill. Nobody told me when I showed up. But in addition to that piece, I know you were able to save a lot of money as well. What was your family able to save per month with Impact Health sharing?
So that $1,800 a month down to $600 with Impact, so $1,200 a month, $14,000 a year. You guys, pre-tax. I mean, in a day and age where people are shopping where they're going to buy their eggs, right? Like they're comparing what the gas price is at the pump and thinking about that. Like just being able to, people are literally trying to save every penny because of inflation right now. Being able to put 5 figures back into your family budget, guys, this is a big deal. We're helping a lot of people with Impact.
Well, Ken, thank you so much for being on this crusade with us and being on today's call. Look, Ken is also a referral partner with us. And for those of you that are on the call, and this speaks to you like it did for me, I know some of you are on here just to learn more about saving money for yourself, your family, your business. But some of you are also wondering right now, how can I be a part of this as well? How can I join the crusade? Is there a business opportunity here? And the answer is yes. There's an opportunity to be a referral partner, make a residual income by referring individuals, families, and small business to Impact. Make sure you get back to the person that invited you on the call. If you're somebody that wants to learn more about the business opportunity, let them know so we can get you on a call designed to explain how the business opportunity part works with Impact Health sharing and their marketing partner. But look, I'm going to open up for questions here in just a second. One last point, I just want to reiterate something Lauren mentioned that we're all very excited about. This has never been done before in this industry. Here in the next handful of weeks, Impact's going to be launching a new initiative, as Lauren mentioned, called their concierge service, where as a member, and Heidi talked about provider pushback. What if there was a way to really eliminate that for 95, 99% of the cases? Listen to this. I just want to re-explain what Lauren mentioned. Impact's going to be rolling out a new initiative that's never been done before, that as a member, you just call their concierge service, to let them know when you want to get your annual wellness visit booked. They'll make that call for you, and they will prepay your appointment before you walk in for your annual wellness visit. And for providers on the call, I'm sure the healthcare company is not booking the appointments on behalf of their members, and they're certainly not prepaying them before they walk in. So that's going to just develop so many great relationships between Impact and so many primary care physicians out there. But Lauren, Melissa, I appreciate both of your leadership. Is there any questions that came into the chat that you thought could be benefit for the community here today, beneficial?
Nobody put any questions towards me, but Melissa says that she has 3 questions. So Melissa, go ahead.
I'll just ask you guys so you can clarify it for the group. One member asked 50 visits. Is that after your PRA, aka deductible, is met? So 50 visits of chiropractic care or speech therapy, what does that include?
Yeah, look, great question. I'll go back to my own personal, just real life example. Let me see if it'll still. Yeah, here we go. So let me just go to my own personal real life example. So out of this $399.35 that's gone against my PRA, $99 of that were from 2 chiropractic adjustments. So you get 50 per year per member where there is no copay associated. Before you've hit your deductible, you just pay for that chiropractic adjustment, and 90% of it applies to your PRA. Remember, there's a 90-10 split. And so 90% of that cost was applied to my PRA. Once I've met my PRA, then Impact will just pay 90% of my adjustments for me. I'm only responsible for that 10%. If I ever meet my $5,000 co-share, they'll pay for 100%. But typically a chiropractor would be a specialist if an insurance company even allows somebody to use chiropractic treatment, and they would have to pay their copay regardless. Remember, with Impact, no provider fee, no copay. So 90% of that adjustment cost is going to get applied to your PRA. If you've already hit your PRA, they just pay 90% of that for you. And if you've also hit your co-share, they will pay 100% of that for you. So I hope that clears that up for people. And again, here's my real life example. $99.35 were from 2 adjustments. I just had a couple others sent in that are now going to get applied to that as well.
Next question is just to double check, regular physical checkup does not require a person to hit their deductible or PRA. So their annual physical checkup, and if a doctor charges $200 for an office visit, and that does not include the blood work, are we paying a difference? So what's exactly included in the annual visit?
Yeah, so the Impact will 100% cover your annual physical. Every single member of the family gets a free annual physical. There's no copay attached to that. And now with the concierge service, they're literally going to prepay it for you, and all you have to do is show up. Some of you, like myself, I don't have a primary care physician. I go to a naturopathic doctor, and then I also go to an OBGYN, and that OBGYN actually considers some of my appointments as wellness or annual physicals. So when they billed Impact, even though it wasn't a primary care, it was just my OBGYN, they still paid for 100% of that visit as well. So if you don't go to a PCP and you go to another doctor that technically does annual wellness visits, that will count too towards your annual physical.
Yeah, and one thing I'll add to that, great information, Lauren, as far as the blood work part. So blood work, again, you get a $150 blood work credit per year. Impact also has a national contract with Quest Diagnostic Labs. So in your Impact Member Center here, I'll show you guys this here as well. So if you go to My Pharmacy and Labs and you go to the Grassroots Lab, that's our program with Quest. So you can actually set up for your annual labs literally right from here. If you do it through the Quest program, they will cover they'll reimburse you for 100% of your annual labs based on the recommended annual labs. Now, if you want to get additional labs, you can see here, extra 10% discount for Impact members on any of those additional labs. But if you go through Quest, your recommended annual labs, they'll reimburse you 100% for it. For me, I went to my primary care physician because I was already there. Impact sent in paid for $150 of that. I think I ended up being responsible for like $75 or $80 of that. But I made that choice to go there instead of through the Quest program. So I hope that helps everybody.
What does Impact not cover?
So the main things here, and everybody can look at the member guidelines, but look, with Impact, remember, we are, first off, everybody should understand now about pre-existing conditions. Pre-existing conditions are repriced, but not shared until somebody, until somebody's been signed symptom treatment diagnosis free for 36 months. Other than that, you can look at the member guideline. Remember, Impact has that love thy neighbor approach where we have Jewish members, we have Hindu members, we have Buddhist members. Obviously, we have a lot of members of the Christian community as part of Impact as well. But we're one of the first health sharing companies, if not the only one, where you don't need to be of a certain faith to be part of the community. However, Impact is still governed by Christian values. So you can look at in your member center what Impact does not believe in, which would basically be things outside of the Christian values, where they do not share into things that you can look at right there in your what's called in the guidelines. And it's really, really transparent. So again, if it's something that maybe would be against Christian values, that's probably not going to be shared by the community. And then again, the pre-existing conditions. Other than that, I don't think you're going to run into many things. But again, you can look at the guidelines just to make sure you have certainty on that prior to becoming an Impact member.
Any other questions, Melissa?
There's one. It's just very lengthy, so I'm trying to summarize it. And I think this is a very common question, so it's good to repeat it. What happens if you go to a doctor that says they do not take Impact, or they already have contracts with certain insurance companies and won't work with others?
So Impact has made it so easy for us to overcome this obstacle because there's so many different ways that you can go about this. First of all, if you're talking about your primary care physician or wherever you go for your annual physical, with that concierge service, I would say it is a 0.0001% chance that a provider is going to deny some insurance or healthcare company from prepaying them. So I believe with the concierge service, you call Impact. Impact calls your provider for you to schedule your appointment, and they pay them on the spot. You guys realize that providers are usually waiting 3 to 6, sometimes 9 months to get paid by insurance companies if they ever get paid. So I believe once this concierge service starts in the next few weeks, when they call on your behalf, they're going to educate them on Impact, prepay them, and you're going to be set and good to go at that provider because they know Impact is going to pay them, right? But if you're going outside of your annual physical, on the back of your Impact card, so when Jeff showed it, the back of the Impact card has two really important things on there. The first thing is a provider support number. So to give you an example, when I went to the urgent care for my meniscus tear, Impact was not in their little drop-down menu, and she just assumed that they didn't take it. And I said, yeah, you do. Can you just call this provider support number on the back? She said, sure. So the front desk person called the provider support number on the back, spoke with someone from Impact, who then educated them how much they pay, how fast they pay, that they can just bill them directly. I was good to go after that, okay? So you can take it one step further. Outside of just having them call the number, you can show them the payer ID number on the back of your card. Every provider knows that this payer ID number means they can electronically bill this healthcare company. So, and the last thing, if you want to dot all your I's and cross all your T's, on impacthealthsharing.com, there's a form you can fill out called the provider outreach form. And you can literally say, as long as it's within 2 business days of your appointment, put in the contact information for your provider, and Impact will then call on your behalf, educate them, and help you get set up. So there are so many different ways if in the rare occasion someone says, I'm not familiar or we don't take this. And then the absolute worst case scenario, you guys, is you just pay up front using a cash pay discount. And then if your PRA is met, Impact will reimburse you, or they'll just apply it to your deductible.
Well, Lauren, great explanation. We're getting ready to wrap up here in just a second. I know there were several questions asked that we're more on the business opportunity side for referral partners, guys. This call is really just meant to educate people about impact health sharing. So make sure if you had a compensation question or a question on referring a business, or there was a lot of questions, referral partner questions, that's not what this call is for. Just get back to the person that's training you and get that question asked so that way they can get it answered. And again, those of you that want to learn more about being a referral partner, make sure that you reach out to the person who invited you on the call so we can get you that information. With open enrollment starting on November 1st. There's so much of a demand for what we have right now. We need help. We need more referral partners so we can take this message out to the market. So if that speaks to you, get back to the person, get that invited you on the call. And we do this call every Tuesday at 11 a.m. Central, 12 o'clock East Coast time. So we invite you to come back next week to learn more. Make sure you also join the Facebook community. As Lauren mentioned, there's lots of great information on there, lots of recordings of past webinars. And we really thank you for your time today being with us. So God bless everybody. Thanks for being on today's call. And this concludes today's webinar.